Welcome back, everyone. We are continuing our coverage of the drug crisis in New Haven after 2 people have died, more than a dozen others overdosing on tainted drugs. Tonight, Dr. Gail D'Onofrio from Yale-New Haven Hospital joining us to talk about the response to these deaths. First off, Dr. D'Onofrio, welcome. I wanted to start off by asking you, help us understand exactly what a public health emergency means.
Sure. A public health emergency is just that. It's that the health of the public is at risk. And nothing really exemplifies that than what happened last night. We started seeing patients coming in relatively early in the evening. That extended further, and we were very interested to know that this was a huge deal and that the public was notified about it. And so everyone ended up getting those announcements.
Yeah, and I wanted to ask you about that. You mentioned it. What was it like in the emergency room overnight? You have all these overdoses coming in. It must have been kind of frightening.
Well, it was. My staff is there and we're prepared. So that's what emergency departments do. We have a physician staff and our nurses and our techs and a whole bunch of other people, and they're prepared to do just this. We had an internal disaster drill, essentially, and so we put people together in teams to start seeing these people as they came in to figure out and prioritize who needed to be seen first.
Well, I wanted to talk to you about the effect. We know that this kind of does a lot of damage to the lungs. This is a difficult but really kind of a poignant example that if you buy and take drugs off the street, you really have no idea what you're taking or what you're putting into your body.
Exactly. We're not sure what this drug was. We know that it wasn't general heroin that people think of as heroin. It was some type of a synthetic drug that acts like an opiate so that it responded to Narcan but not well, the antidote to an opioid. So we had to give the pre-hospital personnel, the fire, and all who did a phenomenal job were running out of Narcan. They were giving so much. And then when they came to the emergency department, if they survived, they were awake, but then they had trouble with breathing and their lungs. And so this has created not only respiratory problems, but renal problems. And we don't know what it is. There is some synthetic opiate-like substance with something else in it that did this, and we're just asking everybody to be very careful. These drugs are not approved by anybody or tested by anyone, and for any drug user out there, please be careful. We'd love you to come in for treatment.
Yeah, and that's one thing that I wanted to ask you about, because I know that you've had a response from family members who have loved ones who are addicted, reaching out to see how they might be able to get some help.
Yes, the phones have been off the wall in terms of our community service providers. So at App Foundation, at our Cornell Scott locations and Grant Street and SCRC, we've had lots and lots of calls come in. We're able to help them. We're able to help anyone who wants to come to the emergency department. We have Project Assert, who are health promotion advocates, who will actually help connect you right there and then, and we can help save some lives if people will come to us first.
Okay, good to know. Dr. Gail D'Onofrio, Yale-New Haven Hospital. That's it from here, and we're going to send it back to you.